Hey everyone, my name is Kelly. I am a lymphedema and oncology physical therapist. Foot and ankle swelling and lower leg swelling and edema are very common and are typically worse in the afternoon or the evening compared to the morning. It can be caused by vein issues or lymphatic issues and tends to be also worse as someone ages. The most common vein issue that causes chronic leg swelling and edema is called venous insufficiency. It's most known for that discoloration, that brown, red, deep purple color that we call hemosiderin staining in the lower legs. And you will also likely see skin changes or thickening of the skin in this area. But today in this video, I'm going to share the main ways that we manage the swelling and reduce the swelling in the legs due to vein issues or venous insufficiency. Before we begin, make sure that you subscribe down below for weekly new videos. You can also follow along with us on Instagram, and you can check out our website for more resources. So before you get in, it's always best to check with your doctor or medical provider to get clearance before starting any new self-treatment to make sure that you have the correct diagnosis for safety reasons. But know that in this video, I'm going to share generally how we manage swelling in the legs and edema in the legs to reduce it for venous insufficiency. Veins have small little valves inside that help push the fluid through them. But over time and with age, these may become weak and the fluid then gets backed up in the system, which is what causes the swelling. So one of the main reasons that swelling is worse in the afternoon and the evenings compared to the morning is that gravity causes the fluid to get stuck and pulled down below. The veins have a harder time pushing that fluid up against gravity, and so people may see that swelling worse in the evenings. So we want to do various things to help support the veins and keep the fluid moving upwards out of the legs and out of this area, especially during the day. So the first thing to do is to try wearing compression stockings during the day. Compression stockings come in a lot of different styles as well as different compression levels, and this does matter. So a lot of people will get basic compression stockings, maybe from a drugstore or whatnot, that just aren't enough to help support their swelling. Basic medical grade compression stocking is 20 to 30 millimeters of mercury of pressure, so it will be 20-30 mmHg. That is a basic compression stocking that is considered medical grade. Now there are also ones at drugstores or online that you may see are 10 to 15 or even lower at 8 to 10. Those may be enough for someone who has mild swelling or occasional swelling, but likely not enough for someone who has more consistent or chronic or severe swelling. These are different types of stockings that also won't work for someone who does have chronic swelling. They may need something more customized like this. This is a flat knit garment. It's a thicker garment and it is inelastic in nature. It doesn't have as much give, but it does a much better job of containing fluid or swelling. So there are just a lot of different options out there. There's also this one. This is a men's compression stocking. This one is 20 to 30. It just looks a little more like a work sock, I suppose. And then there are the basic ones like this one. This is a popular brand. I do like the silicone band on the top because then it won't roll down and cause a tourniquet, because that can also make the swelling worse, and something that I see often if people struggle with wearing compression stockings because they are bothersome. They're usually too tight or they're rolling down on the top, and that can again make the swelling worse or break the skin down. So there's just a lot of options. There are hundreds of stockings out there, but the level of compression does matter of what someone may need. The other thing to note with these is they're called maintenance garments, which means they are meant to manage the swelling and control the swelling. They'll bring you down a little bit if you have some swelling, but they're not going to do a great job of shrinking someone completely. So if someone has really bad swelling or chronic swelling, it's best to work with a certified lymphedema therapist in your area to try to get the swelling down with compression bandaging first before going into compression stockings. There also are compression Velcro wraps. I don't have a sample in front of me, but if someone has a hard time getting compression stockings on and off, there are Velcro wraps that someone can use on the lower legs that come with a hybrid stocking, so just compression at the foot only, and then the leg pieces from the ankle to below the knee that you can Velcro close, and that can also work to help manage swelling in that way. But I will link a few of my favorite brands down below that are considered medical grade, but also just a little bit lower level compression, and then also the Velcro wraps as well. But the compression that will help support the system, especially the veins, so that the fluid can't pool there and keep the feet and the legs from holding swelling during the day. So know that it's not ideal to wear them at night. And many don't really need to if it's more mild because their legs are elevated at night, which does also support the veins. But another way to reduce swelling in the legs and the feet and the ankles is with lymphatic drainage massage. Lymphatic drainage is a massage-like technique, also known as manual lymphatic drainage, to help guide and stimulate the lymphatic system in the veins to move fluid through them and out of the area. It is best to try to use your whole hand with a gentle pressure in an upward fashion out of that area. If someone has swelling throughout the whole legs rather than just the lower legs, they want to do a full sequence of lymphatic drainage starting from the abdomen, working the way down the legs, and then back up. I do go much more in depth with a step-by-step instruction through videos that you can find on my channel, but you can also find a step-by-step instruction handout and resources that I have on my website that I will link down below that give you, again, the diagram and the step-by-step on how to do lymphatic drainage little by little. And they're for the legs, either the right or the left or both legs. If you also have questions on how to do this, it is best to work with a certified lymphedema therapist locally because they can help guide a personal treatment plan for you. So another way to reduce swelling and support the veins is with exercise or movement. The muscles in the body act as a pump to the veins. So by pumping your muscles, stretching, strengthening, you can help stimulate the system to get that fluid moving. I have created many videos and exercise routines for both of these, as well as workouts that you can find or you can follow along with and check out on my channel. So we're not going to go in depth in these videos or in this video on what these exercises are, and you can check those out if you want to learn more. But in general, it's nice just to find something that someone enjoys doing. So whether it's walking, biking, swimming, anything that someone can do consistently, that's going to be the best type of exercise to do for the system. And then the last way to improve venous insufficiency conservatively is with a compression pump. Compression pumps are electric pumps that you put over the legs. You put your legs inside, you close the pumps up, and they have a different number of chambers inside that will fill or inflate with air in a specific sequence or pattern to help encourage and guide fluid out of an area that is swollen. So for example, in the legs, the chambers inflate from the foot and work their way up toward the abdomen to help reduce swelling in the lower legs. I want to thank Aaros Medical for providing the pump and media to use in this video for demonstration. To know if a pump like this is right for you, you want to reach out to a doctor or a therapist in your area for discussion and guidance because everyone is different. But those are the main ways that we support the veins and reduce swelling with venous insufficiency. There are, of course, surgical options and more invasive options out there that you can work with your doctor on. But these are the conservative options that we often see day to day in therapy. You can check out my other videos on this channel for more resources, but otherwise I hope to see you all in the next video. Thanks everyone.